Is a life-threatening illness worth compromising your religious beliefs? In the case study that I chose, an 18-year-old Jehovah's Witness girl who was born into a Jehovah's Witness family is faced with a decision. Were her religious standards worth more than a treatment that could help her in her illness? The patient in this study had anemia. This disease occurs when the total amount of one's red blood cells decrease, and which this causes oxygen also to be lost within the blood. The young girl in this study had sickle cell anemia, which she has battled her whole life. She's been in and out of hospitals and health care facilities her whole life, and she has battled with this her entire life. So by 18, you would think she would be ready to try to do something to improve it. Her painful suffering could be aided by a transfusion, but did the religious traditions hold her back from making a decision in pro to her health? In the profession of pediatrics, sometimes it is hard for healthcare workers to agree with the morality and the family's beliefs concerning their child, especially when it's not what the healthcare professionals would recommend. In similar situations such as this one, the healthcare professionals and the healthcare team had to struggle to find an alternative solution to the illness in preparation to help the patient. As a newly formed 18-year-old, this patient had not been fully informed of her capability to make her own healthcare decisions, according to John Lankos. However, because of the religious standards by the Jehovah's Witness guidelines, the doctors still had to uphold their ethical properties. Dr. Nina Yukachi, Dr. Samantha Van Horn, and Dr. Revanthi Sundaram all worked diligently to ensure the family's needs as well as the patient's health was not compromised in this case. When a life is at stake, the nurses and healthcare team have to stand by the families and the patient's desires, and they have to accommodate to their wants and their needs. In this case, a transfusion was the first line of defense. However, the family was opposed to this and refused to even see this as an option because of their religious beliefs. Even after listing the risk and benefits of a blood transfusion, the family still denied it. So the medical team had to find an alternative route. Dr. Yukachi, Dr. Van Horn, and Dr. Sundaram stated that the next best solution would be to administer pain medications and fluids and keep a close eye on the patient for a while until her symptoms improved. So the patient was closely monitored, and within the first week, according to the case report, she made great improvements in her health. Her hemoglobin levels improved, and she was moved out of the ICU by day 13. For this 18-year-old, she was lucky to be fully released by day 17 with a variety of medications such as iron tablets, which would strengthen her red blood cell counts. In conclusion, the medical team suggested for the patient to also attend therapies that would assist in her rehabilitation to gain back the function lost, which this part of the healthcare rehab would also avoid a blood transfusion, which would accommodate for the family's religious beliefs as well as the patient's beliefs. To conclude, in this speech, I have discussed the case of the Jehovah's Witness with anemia. Because of her outstanding religious beliefs, she was unable to receive the first plan of wellness that the healthcare professionals would have suggested. However, the healthcare team planned an alternative route and an alternative solution that monitored her closely to ensure that she was improving her conditions. In the end, she came out with a chance of normality because of the provisions of the healthcare workers, and she had a solution of iron supplements, folic acid, and several other supporting medications that would help her regain her function to maintain a normal life. This is the case study of the 18-year-old Jehovah's Witness. Thank you.